You are watching The Horizon, the voice of the Amber woman, exclusively on ABC Amba TV.
Stand with Ambazonia. Empower ABC Amba TV. We are calling on Ambazonians around the world to unite and uplift ABC Amba TV, Ambazonian Broadcasting Corporation. In this critical time of war, ensuring the station's survival is more important than ever. But what does ABC Amba TV truly represent for Ambazonia?
At the heart of Ambazonia's war of independence, ABC Amba TV stands as a beacon. Years of recolonization, annexation, and French Cameroon's oppressive occupation of the southern Cameroon's Ambazonia have led to our exclusion. Our identity was hidden, our history distorted, our sovereignty denied. Queen of England is aware that the British Southern Cameroons were never a colony under France.
Since its inception in 2018, ABC Amba TV has been our lifeline.
Months of diplomacy have failed to resolve the crisis as fear grows over an imminent Russian invasion of Ukraine.
Our work in the dark is our chance to tell our stories to the world, to give voice to the voiceless, and broadcast the truth of our struggle.
We are serious about executing this revolution.
It has become a vital arm of our government in wartime, making diplomacy achievable and showcasing our untold stories.
ABC Amba, you guys know how important ABC is for this, our quest for international recognition.
Your donations can make a world of difference. Every bit of support helps keep our stories alive, our presence known, and our fight in the global conversation.
The moment they notice that we are no longer on air, they think that, oh, maybe La Republic has succeeded. This is about Ambazonia. One thing we must always remember.
Where would we be without ABC Amba TV? Let's ensure we never have to find out.
A revolution is a temporary state of insanity to bring about sanity.
Mobilize, donate, stand with Ambazonia, donate to ABC Amba TV.
Together, let's write the next chapter of our history.
It is better to light the candle than to curse the dark.
Support ABC Amba TV campaign. Ambazonia Independence, voice for the voiceless. Mobilize for change.
There is a civil war ongoing in Cameroon. That civil war is between the southern Cameroon's people and the government of the Republic of Cameroon. These were two countries that the United Nations, by their resolutions, tried to bring together to form a new country, the Federal Republic of the Cameroons, that La République du Cameroon decided to dissolve unilaterally, unconstitutionally, and rather preferred to annex the people of the southern Cameroons. And today there is no longer any federal republic that was contemplated when the United Nations forced these two countries to come together. So this is a failed decolonization that has resulted to the annexation of the people of the southern Cameroons. The UN has never looked into this matter like they have for other conflicts in Asia and Ukraine. No. For the 7 years that this conflict has lasted, 1.5 million people displaced, hundreds of thousands of refugees, more than 500 villages and settlements destroyed, burned to ashes, and more than 50,000 lives have been wasted. These are human beings. We are calling on the good people of Brazil and on the good people of the African diaspora to do everything possible to engineer a peaceful resolution to this bloody conflict. They can do that by engineering a proper mediation of this conflict or refer the matter to the International Court of Justice for arbitration so the two parties can present themselves for a peaceful resolution of this conflict. Thank you very much. I'm the president of the Southern Cameroons. My name is Samuel Ikomesako. Thank you.
Okay, I'm on now. Good evening, good afternoon, good morning. Welcome to the Horizon, the voice of the Amba woman. I am thrilled to host two giants of our liberation journey on this program today. One of them is not a stranger on the program and has been here on numerous occasions to share with you valuable information on a myriad of topics. And you all know him as Dr. Fred Lobati. The second guest today, I'm particularly pleased to welcome to our program, is the Secretary of State for Communications and IT, Dr. Martin Mungwa. Gentlemen, welcome to the Horizon, and I'm excited on the topic we have to discuss today, which is on tropical healthcare and engineering solutions for Ambazonia. And we'll also talk about a letter that was written by the Department of Women's Services to Philemon Yang, who is currently presiding over the 79th session of the United Nations General Assembly. So without further ado, I want to welcome both of you on the program, Dr. Martin Mungwa and Dr. Fred Lobati.
Dr. Abiedu and big brother, Dr. Lobati. It's always a pleasure to be here with you. I think I don't have to introduce myself. I hope not in the women's program. And I would like maybe Dr. Lobati to say a few words, then I can come in with what we have to talk about today. Before
Certainly,
I do that,
certainly.
yes, I think Dr. Lobati, somebody I've admired for a long time, having been able to be in contact with him on a personal basis. He's a great patriot, and both himself and the wife. So I think I should give you the right to talk first as a big brother. Over to you, Dr. Lobati.
Wow, that's a privilege. I'm very, very honored to have the privilege to meet with my patients and Dr. Mungwa, our communication secretary, in this program. I think that the topic is really very relevant for our people of Ambazonia, where basically issues concerning public health or the health of people cross with engineering projects. And Ambazonia is a virgin land where, when La Republique thought they were abandoning us, it was a blessing in disguise, because if they had carried out some projects, they would have done it so poorly that we would have to be dismantling poorly done jobs to fix the land. But now we have a land that has not yet been touched, more or less, where we can truly design spectacular developments, engineering projects, where our land will stand out in Africa and the world as a beacon and as an example, almost like Rwanda and other countries around the world, because it's not yet been touched, it's not yet been tampered with, so you can start from a fresh sheet of a new paper. I'm very happy to be here with you guys.
Wonderful. Dr. Mungwa, before you come in, I just want to really formally introduce you. And by the way, I want to extend greetings to all our ASA watching from all over the world, particularly, I should say, Ambazonia, and also to the refugees that are waiting to get home someday, and all our brothers and sisters all over the world. Dr. Mungwa, you are our special guest today, and you wrote a policy statement on tropical care and engineering solutions in Ambazonia, which I'm going to share with our community shortly after this program. Before we dissect the policy statement and the ramifications for Ambazonia, let's talk briefly about you. You are a licensed professional engineer and American Society of Civil Engineering Fellow. So you are the creme de la creme, if I may borrow the slang of the enemy, in your profession. So can you just briefly define what engineering is and tell us what it takes to be a fellow in your profession?
Wow, thank you so much. I'm glad you asked that question. And before I actually get to the answer, I want to take this occasion to thank you, in particular, you and your husband, Dr. Abiedu or Professor Abiedu, for having made the first party, when I was elected as fellow of the American Society of Civil Engineers, which happened in California, in Anaheim.
Yes.
So, and you invited me to your house. I came with my son and my wife, and I mean, you spent so much money, and thankfully the president was there too. You welcomed us to your lovely home. We were treated like royalty. I can't forget, and I want to use this occasion to thank you for that memorable evening we spent together. Now, coming to the substance of today's topic. Again, welcome to this program, fellow Ambazonians and friends of Ambazonia. This series of meetings that I'm going around in different programs talking about the future of Ambazonia is very critical because we want to show the world that we are not just sitting by like other countries that have gotten independence and suddenly gotten into problems that they cannot resolve. We are a mature country. We're the first country in Africa to actually practice democracy, which many people do not know. And unfortunately, we are still enslaved today. So it's a very sad thing. So we want to prove to the world that we are different. We want to prove to the world that the problem that we have with La Republique is ethics. Ethics, that's all. This war is about ethics. If anybody tells you that it's about anything else, then that person doesn't seem to understand. That is the root cause of this war, is ethics. Not being able to be accountable for things you do. Something that we knew in Southern Cameroon in the 50s, accountability. People are stealing all over the place. You can look at what is happening. You said a young lady related to Chantal Biya has embezzled billions of dollars. How can we accept that to happen? That's why we are fighting. And nobody should give up this fight if the problem of ethics is not resolved, because it would take La Republique at least 50 years to come to the standard in which we are now today. Okay, so let me just put this preamble out there. So people who don't seem to understand, they are not seeing the problem and just making loud noises and being afraid that, oh, we want to leave and so on and so forth. This is what is on the table. Because until we resolve the matter of ethics, we cannot live with these people. They have a different mental state, which means they have been colonized. They are ruled by Vichy despots. They manipulate them. They steal from their own people to give to the French. And the French support them as individuals. That's why they call them strong men and strong women or whatever. You have to understand this. Okay, let me talk about engineering. Engineering, that means the application of scientific and mathematical solutions to solve societal problems. And these problems can encompass design of buildings, roads, maintenance structure systems, processes, solve real-world problems. That is a very simplistic definition. Another definition from an economic point of view is that an engineer is somebody who can do something for $500 that everybody can do for $1,000, which means that you put in the whole idea about economy. You know how to use materials economically so that you can give a better product. So engineering solution, many people can provide it, but at what cost? That's the question you should be asking you. And that's where engineering plays a central role in the way we develop our cities. Okay, I'm going to talk a little bit further down the impact and the importance of engineering. I find it, I know it's like blowing your own horn. What does it take to be a fellow of the American Society of Engineers? I try to be as simple as possible. There are probably about 3 stages. And before that, let me tell you what happened to me. When they wrote me a letter that they wanted me to apply to be a fellow of the American Society of Civil Engineers, I was shocked because I didn't know I wasn't going to any meetings. I only remember that in 2001, I was asked by I wanted to teach at university, so they asked me to come and present to the students because those who are familiar with hiring at university in America, you come and present it to students. They see your area of work, they ask you questions, and so on. And after that, they either hire you or they don't. So I went and presented my work. It was so spectacular that I was hired immediately.
Wow.
However, I had a family issue. I could not take the job. I had to turn it down because some family issue I had, and I have to move east. But with that performance, I did not know because it was actually put together by American Society of Civil Engineers. I didn't know that they had taken my data, and they had been tracking me for 20 years. All the things that I've done, they were tracking me. And in 2019, they said, and I had written some opinions in the Civil Engineering Digest, the American Society of Civil Engineers. Some digests I talked about communication, education, and the difference between education in England, the United States, and some of the pluses and minuses. And I show a very deep, profound understanding of the way engineers are trained in both systems. In Ambazonia, they are similar, but there are some differences, and there are some pluses and some minuses. And so they contacted me and said, why don't you become a fellow? This is something that people apply to, and they really hope they get appointed. Because remember, to be a fellow, you have to be on the top 3% of engineers in the United States. That is a big load on you. You must be good. Top 3%, that's 97 percentile. So only 3 out of 100 engineers make it to fellow in their lifetime. And the American Society of Civil Engineers is the most well-known engineering society, at least within civil in the entire world. So if you're American, if you're a fellow, then you are recognized worldwide. So I wrote back to that. I said I was not qualified. I said, I am not qualified. I haven't been going to your meetings. Please, I just want to make this very clear. That was in 2019. So I sent them back. I said, I'm not interested. I was even becoming afraid that I don't know what these people are looking for. 2020, they wrote again. They said, we have requested you not even going to meetings, because I used to be in the Metro chapter, that's New York City, but I don't go to those. I've never been to those meetings, even right up to now. They say it doesn't matter. Your achievement in engineering has nothing to do with going to your local meetings or participating in some seminars. So I sat down and I wrote and I sent it to them. They wrote back to me and said, for you to be a fellow, you must be recognized by your peers. Means you have to have at least 2 fellows write about you and say you are qualified. All I had was members because I was a member of the American Society of Civil Engineers. So I sent a lot of recommendation from members. They said, no, I do not know a single fellow. In my company of 15,000 engineers, there was no fellow, not of the American Society of Civil Engineers. So I didn't know anybody. But there was one person I had met before. He was a consultant to my company. And he once had a bill that we did not pay. And that bill, unfortunately for me, when my manager went on vacation, I was the interim departmental head. So I had to go and meet with him. This was an old man. And I discovered that he was a PE in 1957. So, but one thing I caught in that person was respect. When he discovered that I was an engineer, civil engineer and a PE, that guy behaved as if I was the king. He treated me with so much honesty and respect. Then I started understanding, oh, wow, is this how professional engineers are respected? That was the only encounter I had with that old man. 10 years later, I remembered he was the only fellow I knew because they gave me a list of fellows to write to. I called him. The man was on retirement. He said, well, I remember that time I came to your company, but I'm on retirement. My secretary is in Naples, Florida. She's also on retirement. I'm calling her to draft something about you. I know how to get information about you. That person wrote me a most powerful recommendation I've ever seen in my life. Now I had one. I need number 2. So I had this. I didn't know what to do. So I called another friend who had suggested that with my advanced knowledge of engineering, because I did a lot of stuff, I should be holding meetings in a company and will be recognized by American Society of Engineers as a part of their continuing education. And he said, well, but I know a retired professor at CUNY, City University of New York, a civil engineer. Maybe we should contact him. So I wrote to the guy. I had never met him, and I still have never met him. And I gave him my background. Now, I discovered that for you to be a fellow, there are three important things you have to accomplish in your life. You must have contributed something significant in engineering that very few people know about. What was my area of expertise? My area of expertise was time-dependent analysis, what they call stress migration in structures, how structures get old. I had been involved in that ever since I was a professor, and I worked on it, and that's how I was hired to come to the United States because of my knowledge of aging in structures. But I work in the wood industry. So I was able to translate this information to old buildings. So that was good. The second thing they wanted me to demonstrate was I am a member of at least 2 or 3 different professional organizations because they must see how versatile you are. I was a professional engineer for 22 years. That is a good thing. I was also a certified project manager since 2010. That was about 13 years. And I'm also a special inspector, a specialist in bolting and steel and bolting. People do not know that whenever you design very, very long bridges and high skyscrapers, the most important design is how elements get connected because that's where failure occurs. It is a critical part of a structure. And most engineers do not know how to design connections when you come to very heavy and very tall buildings. And therefore, in fact, this area of expertise, there are some companies, especially in Chicago, and there's a reason why it is in Chicago, they always specialize in bolting. No matter the configuration of the structure, they will design the connections for you because that is the principal source of failure. I don't want to go into the theory of connections. That's not part of this discussion. However, so when I talking about connections, so talking about Chicago, the reason why Chicago comes into place because they call that the windy city, right? I think all of you in America knows that, is that you cannot practice engineering in Chicago without passing an exam on wind loads. It is very important. So, so that was my connection. So I worked on connections. I worked on aging, and connections is a critical part of aging in structures. So that part, and becoming now a special inspector for bolting, that gave me that third area of expertise. That says, yes, you are versatile. You are not just a civil engineer working in a very, very isolated area. But what capped it all was opportunity. And I say this because people think that when you graduate university with a first class honors or second class honor is a big deal. It is only a big deal for that moment. Let me tell you this trick. Moving into the future of your profession, you have to learn to be curious. Curiosity means that you look for areas that are probably related to your profession, yet you don't know. You have to learn to encapsulate that. When you build that knowledge, that's when you become an expert. And very often, our people run away from what they don't know. They simply focus on the little thing they know so well, maybe with a PhD, and they go around bragging. That is no knowledge. You'll be surprised that somebody who had a third class degree, who looked for opportunity to expand his knowledge, will be a better engineer in the future. And you may just be relying on, oh, I had 5 A levels at this, I have 14 O levels. That is nothing. It's just momentarily. Opportunity is key. And that's why in Ambazonia, we're going to create opportunities. So we create as many leaders as possible. So nobody should be afraid that, oh, because I did not have 5 A levels, or because I did not have 10 O levels, I'm not going to be good. No. Opportunity. And that comes to my point. So when I joined a Fortune 500 company, utility company,
hey, Doc.
Yes.
Doc, I don't want to rush you. I just want to make sure you understand we have a lot of questions to go through. So if you can just summarize this part.
Yes, it is so important. So when I was able to address all these things together, and I worked on a $350 million project where I was the discipline engineer, that capped it all. So I was able to gather all this knowledge, and now being in charge of, you know what it takes to be head of a $350 million project? It took 6 years before I finished it. And it came with a lot of problems. I was able to solve them. So when they presented this to the American Society of Civil Engineers, that's how I was made a fellow. Wow. Okay. So it is not just the background. That's why I have to go through I'm sorry I was a little bit, to elaborate. But it goes through the whole, I now contribute to the economy. And in fact, I had two people from the Department of Health and Human Services for Washington, D.C. They called my company, said they wanted to talk to me. They came, two black ladies. They said they want to talk to you. I said, what? They said, we don't know. They brought me into the room. They said, if that interview is more than 1 hour, there's a problem. But if it is short, then you've made it. That's what the vice president told me. So they put me in that room. These two ladies came, and thankfully, there's a subway just across the street. I saw this modest lady came, sat, greeted me. And after about 15 minutes, they said, thank you for making sure that people have clean water in New York City. That was all they told. I never saw them again.
Wow.
That was the end of the story. So it's taking just curiosity. And I hope that people listening to this program should know that it doesn't matter what your background, so long as you are curious, you are going to achieve it in life. It's not about being the most intelligent in class. It's not about having 5 A levels. It's not about having 10 O levels. It doesn't mean that you graduated, you went to MIT. All that is good. But for you to progress in society, you'll be surprised that people with even much modest backgrounds can do even better than you. I hope I've answered.
Absolutely. That is so remarkable. I think our people are listening and learning that if one of our Ambazonians can do this, then there's an opportunity for us to learn and do the same thing. So we'll just delve into the topic today, which is about the public healthcare and engineering solutions in Ambazonia. So from the policy statement that you wrote, which I've promised to share with our people after this program, you have described the role of engineering in tropical medicine under 3 categories. You talked about infrastructure development, you talk about water and sanitation system, and waste management. I'm really bringing this up because I want Ambazonians to really see what we are missing, especially living in our current situation with all the great corporations and companies we had in the past. So kindly describe each with examples so that people can understand. That's infrastructure development, water and sanitation system, and waste management. And after that, I'm going to have a question for Dr. Lobati.
Okay, good. So, I mean, as you said, the topic, tropical public health care and the role of engineering and appropriate technologies. So we know that public health care in Ambazonia faces unique challenges due to their region's climate, geography, socioeconomic conditions, the prevalence of tropical diseases, inadequate health care infrastructure, and limited access to clean water and sanitation facilities require innovative solutions. Engineering and appropriate technologies are critical to addressing these challenges, ensuring the health and well-being of the population and supporting sustainable development. Before I even answer these questions, you are in the health domain. So let me make a statement here that's very important. You cannot have sanitation without water. The two go hand in hand. Okay, so that's why we always talk about water and sanitation. The two go hand in hand because they play a role. Whether that water is clean or dirty, we still need it, depending on what we're trying to resolve. So when we talk about the role of engineering in tropical public health, infrastructure development, for example, the construction of health facilities, engineering plays a vital role in designing and constructing health facilities that are resilient to the tropical climate. For instance, building hospitals and clinics with proper ventilation, insulation, and water management systems can prevent the spread of airborne and waterborne diseases. So in Ambazonia, health facilities must be designed to withstand high humidity, heavy rainfall, and potential flooding. And we've seen examples of a lot of flood in our communities in recent times. Engineers can incorporate rainwater harvesting systems, solar energy, and waste management facilities to ensure these centers remain operational under adverse conditions. For water and sanitation systems, we give examples: community-based water filtration systems. Engineers can design and implement water filtration systems that utilize locally available materials and renewable energy sources to provide clean drinking water to remote communities. And here we mean by using appropriate technologies such as sand filters and solar-powered UV purification, communities can access safe water, reducing the incidence of waterborne diseases like cholera and typhoid. Now, for waste management, an example is sanitation solutions for urban and rural poor. Developing waste management systems that cater to both urban and rural areas is crucial. This includes designing latrine septic tanks and waste to energy solutions that are culturally appropriate and environmentally sustainable. In densely populated areas, engineers can implement biogas systems to convert organic waste into energy, providing a dual benefit of waste reduction and energy production while also improving on public health. So these are the three areas that you did mention, and and uh, and examples. But let me. There's something I have to add on to this. When I was hired as a lecturer at the Polytechnic in Yaoundé, one of the things I came back with a double background. I had a background in structural engineering. I had a background in tropical public health because I was so lucky that I went to a university that was the only one in the entire United Kingdom and probably the world that teaches tropical public health. So when I saw the approach to health from a tropical perspective, I just got entangled in it because I knew where I was coming from. So I took a personal interest in public health, and that's why I'm talking about it today. So when I went back to Yaoundé, what did I notice? I noticed that there were two waste management facilities that many people do not know that exist. There's one that addresses the University of Yaoundé, and there's one in Mesa. Mesa, that's where the French were living. All those high rises in Mesa, they actually had a what they call an aerated pond. So all the latrines were connected to that aerated pond. So that pond will turn, it's a mechanical system, will use air, and it will break down by aerobic, process. It will break down the complex molecules and release hydrogen sulfide and methane and so on. So it was working very well when the French were there. But when they departed and we Africans started occupying these apartments, you discover that at some time in the night it smells. And there was time that if you go to Mesa, because the pumps have stopped working, nobody maintains them. The whole place stinks like hell. Nobody thinks about it because nobody has ever understood what is the waste disposal system. They've just left it to, in dereliction. Take the University of Yaoundé. Can you imagine that with the hundreds of thousands of students that have gone through a university, nobody ever hears about the toilets getting full? Why? Because they have a stabilization pond. If you look around the university is at the top of the hill. If you look at it through Obili and so on, you can see that there's a little lake. There are lakes there that flow very slow. Those are different stages of aeration. And these complex patterns get broken down. You see green grass, some plankton growing in it. It's very fertile. Nobody knows about it. And that's why that university said, despite the poor management system, that university, well, I discovered that when I started teaching. And therefore, when I was made head of department, I did two things. I created two projects. One project was to link the University of Yaoundé to Polytechnic using a footbridge which was pre-stressed concrete. I just said that this is sort of practical solution I may provide, but nobody ever cared about it. The second was, in the department, in the environmental engineering department, they only talk about water supply, low potable. I said, how can you have potable water without sanitation attached to it? So I created a course. Look, I'm a structural engineer. I started teaching a course on wastewater and tried to talk about biochemical oxygen demand, but nobody was interested. But as head of department, I had the power to do it. I changed the curriculum, especially in civil engineering, and I structured something that resembled what you do in the UK. When people graduate, they can actually do something. I'm so happy that some of those graduates are full professors, some in Britain. And in fact, one of my students is in Catran as a professional engineer. Catran, to be a professional engineer is one of the most difficult in the world. So at least I have a student there who works for Catran. And he actually designed one road from Sacramento down to Los Angeles. Anyway, so that is the challenges. So this is what I was able to pick up as an engineer working in the environment. But I saw lots of engineers who had no curiosity whatsoever. Not at all. Or they were bragging to me, oh, I have a first class honors from Furabe College. I have a first class honors from... They did not even know what was the code of practice in place. These are people who are using codes in this 1954. I saw one guy, I think from Furabe, who used the British code of practice in 1954. Yet it was 1985 when we had the new limit state design code, what we call BS 8110 or for concrete, or still 5950, which I still remember. They weren't interested. And how do you have engineers like that? That attitude will impact some of these questions that we'll answer in the future. In the later part of this program. Thank you. Over to you.
Thank you. Thank you so much. Wow, you've really given us a lot of information on the role that engineering plays in public health. Dr. Lobadi, coming to you now. You read the statement that the policy statement that Dr. Mungwa wrote, and I want to pick your brains on this particular subject. Um, he addressed the application of appropriate technologies in combating tropical, some of these tropical health challenges. One of them is telemedicine and mobile health technology. And you're a medical doctor, and I thought this is really up your alley. Can you explain how this is achievable in Ambazonia?
Wow, that's a very interesting topic indeed. I would just want to make a comment about all what we've heard from Dr. Mungwa. You can see that Ambazonia has talent, and we're very blessed with people like him, and there are many more. When La Republique thought that they were sending out Ambazonians into the diaspora in order to avoid any challenges to Bia's government, and now we have over 4+ million Ambazonians abroad. They were rather sending us to go and practice and train so that when we come back, we will bring back that talent and develop Ambazonia. So that's the first thing I'm going to say. We have a lot of talent all over, just like you saw Dr. Mungwa in all fields. I will not go into medicine too much there. But the other thing we also know is that, the engineers go first and the others come from behind. So they had to develop not only the road network, good road networks, but all the necessary stable infrastructures for people like us doctors to come now and sit in offices and talk to patients, or lawyers to practice, or pharmacists to operate and things like that. So the engineers, they break ground, they're the pioneers. They go first, prepare the ground well, and then the others follow. So this has been demonstrated in history. Over 100 to 200 years ago, the leading cause of death in the West, like here in the United States, was tuberculosis. Before antibiotics were discovered, just by the Industrial Revolution and major development that took place, the rate of tuberculosis significantly decreased because antibiotics were only discovered after the major ones we talk about after 1938. But before then, they had already developed all the road infrastructure, the major developments. Homes were now getting bigger. You had fewer people living concentrated in a small area. And that alone improved health conditions, and diseases like tuberculosis, like I mentioned, significantly decreased. So too is the same. It's going to be with Ambazonia. You realize that due to the neglect of the Bia regime, people are concentrated in the small towns like our Bamenda, or if you take La Republique cities, Yaoundé and Douala, people are only there. While the country is big, because there is no road network, everybody's trying to go where they can get something, and they get heavily concentrated in small areas. The roads are bad, and so many other terrible things, like the streams are blocked with plastic papers. We try to enjoy the modern products which are contained in plastics, but we don't know how to dispose of them, and they block the streams, and then we have all the flooding and all the things that happened. Anyway, with good engineering, we will be able to clear all of that for Ambazonia. But coming back to the aspect of how we can use engineering products like telemedicine and others to cater for the health of Ambazonians. Some people may not understand exactly what telemedicine means. With modern technology and social media, we can talk to our people, and you can see your family member at home as you talk to them on the phone, even if it's WhatsApp. Before, it used to be Skype. So with telemedicine, basically, say a physician is here, like I'm here in the United States. I can be talking to an Ambazonian back at home in their home, and they can see me and I can see them. And with the assistance of somebody, by this patient, let me call this sick person now a patient, they can ask specific questions that they can answer. They can actually do some exams. I can ask them to do some maneuvers on the body that will help me diagnose what is wrong with that person. And then I'll be able to provide the healthcare that they need, give them advice, as well as direct them to get some medications. That was something that was remote and difficult. It's being practiced here in the United States. There are some places that do not have enough healthcare providers, and so You can have, for example, in psychiatry, we have right now in our health system psychiatrists that live in Florida or Wyoming, and they basically use telemedicine to reach out to patients, talk to them, and listen to them, diagnose them, and prescribe medications. So those things can be done all over the land. And with modern social media, it's going to become even more and more easy in the future. In terms of mobile clinics, it's come to my mind. We have our local small markets in all the little small towns where our people used to travel on what they call market days to go and sell. And you can buy like one of these bus systems that transport patients from Yaoundé to Douala. You can equip it with medical equipment, not only refrigerators and microscopes and a small lab. You can have a simple technology like ultrasound technology and others in that bus, as well as medicines like a small pharmacy. And you can drive to rural areas on specific days when the crowds are there, and you'll be able to operate as a clinic, a mobile clinic, and listen to people who come to see you, examine them, and do a simple tests and provide them medications. And those that are more complicated, you can refer them to come back to an urban area for treatment. Now, when I used to work with the Baptist healthcare system, Bingo, Bingo Hospital is specialized in leprosy, and so the Swiss were financing basically this aspect of healthcare at Bingo. And what they did was they would take helicopters and fly to rural areas like Esimbi, for example. There are no roads to go there. And these flying birds, as the locals would call it, will arrive, and the people will gather around the flying birds. And the doctors would take time to examine them, find out those, because leprosy manifests primarily on the skin, find those who have leprosy, diagnose them, and these have the privilege of they can be taken into total care with the financing from the Swiss, taken back to base mainly in Bingo, where they are housed for free, fed for free, all of their families are catered for. And so that was another mobile clinic where you can fly because of poor networks, road infrastructures. You can fly to an area and spend time, examine people, and provide care. And with the advent of artificial intelligence, it's even going to be more spectacular in the future, in the sense that just using your handheld phone, many people can basically plug in their medical diagnosis, their age, and their symptoms, and artificial intelligence will be able to tell you what is probably wrong with you, and also what can be done, and things like that. So basically, the opportunities are endless. I cannot, I will not do justice to be able to enumerate all of them, but it depends on how well educated the individuals are, because these things are available even now, but many of our people are not very knowledgeable enough to know how to use their handheld phones, or the capacity and that the handheld phones have, because many of them are buying the best that is available in the market in the West and sending it to their family members back at home. They use them mainly for talking with each other, but you can use that phone for more than just talking with somebody. You can get good information. So all the opportunities are endless, but to reach everybody, including those who are not well educated, will need the engineers to develop the infrastructures, the road networks that we're talking about, all the whether it's bridges. You see that Ambazonia has a lot of mountains and hills. So the connectivity, which you see the Chinese do, they're able to dig roads through mountains and preserve the features of the landscape. So you don't have to destroy the land to have communities that are separated by mountains to interact with each other. All those things, as the engineers come to be able to actualize their knowledge and skills in Ambazonia, will reach people who are not very knowledgeable. Not everybody has to know how to use their handheld phones to get the best out of it, but we'll be able to have infrastructures that will meet the needs of our people. There are so many things that I can mention there, but I will stop there for now.
Wow. Thank you so much. Thank you so much, Dr. Lobati. You've gone through this portion of appropriate technologies. I'm going to continue on this particular subject. I will ask Dr. Mungwa you wrote the statement, so this is in your blood. How about renewable energy and another technology to be used in Amazonia? How will this apply under this subject?
Absolutely. It's an emerging area today, which is very important because of the cost associated with it. So we talk about renewable energy for health facilities. We have power refrigeration for vaccines. Implementing solar powered refrigeration systems ensures that vaccines and other temperature sensitive medical supplies are stored correctly, even in areas without reliable electricity. And this technology is crucial for maintaining vaccine efficacy in tropical regions where power outages are common and ambient temperatures can compromise medical supplies. So, renewable energy sources like solar and wind power will be instrumental in powering health facilities, especially in off grid areas. In Ambazonia, solar powered water pumps can ensure a consistent water supply for sanitation, while renewable energy can also support telemedicine infrastructure by providing reliable electricity to clinics and hospitals. Now, the use of solar power is not only limited to the tropical areas. Even here in the United States, is becoming a very, very important source of business and a means to cut down on your electrical cost. In fact, I have solar panels on my roof right as we speak, which has significantly cut down on the amount of money I pay. I pay for electricity, and they call that a zero metering, which means that during the day, when I manufacture excess power, I put it into the grid, and at night I will borrow from that grid at a lower cost, and so it really helps me to reduce the cost of electricity. We can use this in Ambazonia, and today, with advances in battery technology, we can actually have a system where during the day, when we capture that energy, we can store the energy in batteries such that during off-grid period or during times that we don't have sunlight, and that's why we call that an intermittent source of power, we can actually borrow from the battery. So battery technology is advancing remarkably, and this is a great source in order to power our homes and this something, and obviously our health care facilities, so that we can have a continuous service to our communities. Over to you, Dr. Abiedu.
Yeah, thank you so much. This issue of solar powered refrigerators for vaccines. Sometimes I've always wondered back home, how sometimes they say they take vaccines to remote areas, and you wonder about the integrity of those vaccines, whether they've been preserved properly. These are really solutions to that, where we have energy in our, just readily available through solar energy to preserve those vaccines. I really, really look forward to the Ambazonia we're fighting for. Dr. Lobati, I'm going to come to you right now. You are a medical doctor who practiced in Southern Cameroon for quite a while before coming to the States. And right now, we want to just veer towards talking about some diseases, knowledge about tropical diseases. And I just want you to start by talking briefly on what water-washed diseases and how prevalent are they in Ambazonia, because these diseases are there, and we have engineering solutions to those diseases, which Dr. Mungwa is going to address. So what are water-wash diseases, and how prevalent are they in Ambazonia, Dr. Lobati?
So water wash would be, where you have scarcity of water, or even the available water is in poor condition, not well taken care of. Generally, for humans living on Earth, we need averagely about 50 to 100 liters of water a day to meet our daily needs, not just what we drink, but to take our basic hygiene, cleaning, taking a bath, or cleaning your, around the home, and basic things that you need to live a good life. We need about 50 to 100 liters, which is almost around 13 to 14 to almost 25 gallons in terms of American way of looking at it. And right now in La Republic, public records are not reliable. La Republique claims that people can have almost 170 liters of water a day averagely in La Republique du Cameroon. I call it La Republique because of the government led by Paul Biya. Here in the United States, people can use up to 5,000 liters of water a day. Canada uses almost 3,000 liters of water a day. But we know that even in a society, when they say in La Republique du Cameroon, you have an average of about 170 liters of water a day, there are people who have very little of that, almost nothing. And while there are others that have more than they needed, you will see in La Republique du Cameroon, for example, in the extreme north, how children travel for miles upon miles with gallons, digging into holes and almost some falling into those pits, trying to get some little water that they have to carry back home. So you have a lot of scarcity of water. And because the water is scarce, the people try to use them economically. They may not store them in a good way, and that can also be a harbinger of disease. The fact that they have very little water, and when the water also is not kept in good condition, it can also bring disease. So there are so many diseases that are related to that. Um, you can name them in the tropics. They would diseases like cholera, typhoid fever, and all the other things. You realize that some of our people have dug wells not far from the latrines, where human feces or excreta will easily, drip into the wells, and the people do not know how to filter them or don't have the means to buy filters to filter this water. And so when they drink it, then they can easily get diseases that are transmitted through feces, like I mentioned, the cholera or typhoid and so many others. So there are just too many of them that you can mention, but primarily these are conditions or diseases that emerge because people have scarcity of water, or the little that they have is kept in poor condition. I already mentioned earlier how in the cities, say Bamenda, for example, the small streams are now blocked. People are throwing their dirt, all kinds of dirt you can imagine. We don't even want to mention them because some of them can be disgraceful. They are throwing them into those streams. They have blocked the streams from flowing, and basically they're very unhygienic. And those who live around the streams, they try to use those, and they eventually end up having diseases. Those are some of the things that I will say right now.
All right, thank you so much. So, Dr. Mungwa, so your paper explains the difference between water-wash diseases and water-based diseases and waterborne diseases. You talked about cholera and dysentery. That Dr. Mungwa has, Dr. Lobati has mentioned those. And I'm just going to put them all together and ask you an opportunity to answer the questions. So from your article, the water-based diseases are something like schistosomiasis, which I don't know how prevalent it is in southern Cameroon, Ambazonia. And the waterborne disease, you have cholera and dysentery, which are people really die of on a daily basis. I mean, sometimes you have cholera outbreak that we really want to prevent. And then the water wash disease like scabies and trachoma. I want to ask you from an engineering perspective, what are the solutions to these diseases? And then after that, I'm going to go back to Dr. Lobati and ask him about the water-related insect disease, which is mainly malaria, to talk more on that because that's more prevalent in our country. So Dr. Mungwa, what are these engineering solutions to these diseases?
Thank you, Dr. Abiedu. And I also like to congratulate Dr. Lobati for giving a very great definition, great explanation as it relates to our environment. So, water wash diseases like scabies or trachoma, um, the solution is to improve the access to clean water. And how do we do that? We have community water points. Engineers can design and construct community water points that provide easy access to clean water, reducing the reliance on unsafe water sources. By increasing access to clean water, communities can improve personal hygiene, reduce the incidence of water wash diseases. We started doing what I just read in the 50s and 60s in Ambazonia. When I was a kid, I went to school in Yenji, in Batubo area. I remember we had a public catchment area where we go and collect pipe-borne water for that catchment area. I remember I was still about, I don't know, 6, 7 or whatever, maybe 4 to 6. We went there to collect water. As that was the earliest memory to see a community water point. But I don't know whether it exists today. You go to some areas of Banso, they have pipe-borne water that is actually designed and built by the community, self-reliance. So these are methods that we already knew. I mean, you go to my village in Endor Plain, we have pumps that were designed from the British or German era, okay, where we have these wells that with hand pump that you turn and you get very clean water. So when we talk about waterborne disease like cholera and dysentery, we have water treatment and sanitation, chlorination and water filtration systems, implementing chlorination systems in public water supplies and promoting household water filtration can significantly reduce waterborne diseases. These systems eliminate pathogens from drinking water, ensuring safe consumption and reducing disease transmission. I mean, let me go to a little bit of microbiology here. I'm not an expert, but I remember during my training years as a tropical public health engineer, one of the ways that we determine whether water was contaminated is to identify the presence of Escherichia coli, or E. coli as we call it. That is, it means that it has been contaminated by human feces. And there is a World Health Organization standard for clean water. It says that if you have, I hope it's still relevant, if you have 4 or less coliforms, okay? Coliforms is what they call an indicator organism. Indicator means that the moment you see it, therefore it has been contaminated by human feces. Or if it is animal feces, which is equally as bad, it is Escherichia aeruginosa, okay? So I remember from these days, and that's how you identify water. And essentially what companies like ScanWater do is that they dig a pit, they take the water, they test it. If it doesn't meet WHO standards, they simply cover the pit and they go somewhere else. They have no time for filtration. This is technology that we can all do. It doesn't take rocket science to understand how to take a test tube and then do some chemical reactants and determine exactly the number of coliforms in that water and to determine whether it's clean or not. So when we go to water-based diseases, schistosomiasis, safe water infrastructure, example, irrigation and drainage systems. Engineers can design irrigation systems that prevent the accumulation of stagnant water, reducing the breeding grounds for water-based disease vectors. And the explanation is that properly designed drainage systems prevent the spread of schistosomiasis by eliminating the habitats of snails that carry the disease, okay? And lastly, we talk about insect vectors, mosquito control through environmental management, engineering solutions such as drainage of standing water, construction of insecticide-treated bed nets, and installation of window screens can reduce mosquito breeding and human contact with vectors by controlling the environmental and using engineering solutions that the incidence of diseases like malaria and dengue fever can be dramatically reduced. So over to you, Dr. Abiedu. I think this is what I have for the engineering solutions. Thank you.
Thank you so much. So in a nutshell, you have mentioned examples of improving access to clean water, water treatment and sanitation, safe water infrastructure, and vector control engineering. Those are the key things that I take from this that people should learn. And they are not doing them in our country. Well, I should not say in our country. They are not doing them in where we are. I mean, you've given examples.
That's why we're leaving. That's why we have to go. We have to establish a community that recognizes and appreciates
yes,
all these
absolutely
improving on our lives. Yeah.
Oh my goodness. Moving along. Dr. Lobati, now next to you. When I tell my friends and family members that I've never had malaria fever, people think that I'm joking, that I'm from somewhere else, from another planet. But that's really the truth. All my siblings have had malaria fever. I've never had malaria fever. I don't know what malaria fever feels like. The reason I'm bringing this up now is that we're going to talk about water-related insect vectors disease,
Mhm.
malaria. How serious are these diseases, and what socioeconomic impact do they create in Ambazonia, Dr. Lobati?
You're very lucky that you never really had malaria. I've had them myself. I mean, where we lived, about 5 times a year, you have the symptoms, which are predominantly you have high fevers, headaches, muscle aches, and you can have other symptoms like even some gastrointestinal. That's like you may be sick to your stomach and throw up, but primarily headaches, fevers, muscle aches, and cramps. Some of these patients, when they are talking to you, they already tell you that I have malaria. You're only confirming by doing the blood test. And some people diagnose themselves and treat themselves without having to go to the doctor because we already know how it feels. So you were very, very lucky to have not had that. You remember that countries like the United States, developed nations, especially the United States, they also had malaria and all these diseases. But through very good technology and development, you hardly hear about malaria anymore. So malaria is an indirect water-related disease in the sense that the vector that transmits the organism that causes malaria, the mosquito, it completes its life cycle in standing water. So you don't see standing water across all over the United States here. They make sure that you know um, everything is cleared where you live, so you hardly get mosquitoes. Now they talk about West Nile virus, which is also transmitted by a mosquito and things like that. But it's through birds in the air, but not like the regular mosquito that you know develops in standing water. But in our society in Ambazonia, we have a lot of standing water. Even in during the rainy season, people have big containers, gallons, or that they use to collect water to use for the family, and this water is standing, it's open, and mosquitoes now. We even see the mosquitoes growing in this water. And these are the mosquitoes now that transmit the parasite from person to person. And that is what causes malaria. So, in fact, to prevent malaria, one of the major things you do is to prevent standing water around where you live. That's why people who live in marshy areas around the streams and the rivers, they get more malaria than those who live, say, up the mountains or far away from such locations. And of course, you can put other things like mosquitoes around your window to prevent uh, mosquitoes from entering the house through the windows and the doors. Or you have the mosquito nets around the bed so that at night, even those that are in the house will not be able to reach out and bite you. And yet, they still sneak by and bite us. The economic impact is great. If you are sick for like 1 or 2 weeks, 5 times a year, you are taken away from work and school and many other activities. You will not be, I mean, when malaria puts you down, you're really sick. You will not be able to go to work. And that already robs a society of economic activity that generates uh, money, you know, contributing to the GDP. And then many people die, little children, many of them die ignorantly because they were taken not as soon as possible to doctors to get treated, or they were not treated properly. We had some experiences where people were doing traditional medicine when children were sick. Instead of taking them to the doctor, they took them thinking that they were trying to help and administered some herbs which do not kill the parasites in the blood. And the children then die from anemia and things like that. So malaria in this case, it affects the red blood cells in your liver and other organs. It destroys them. People get anemic, and when you're very anemic, you're weak. You cannot produce to your peak potential. So they remain weak, and some of them die because it can destroy your kidneys to the point where some people need temporary dialysis. But we don't have dialysis in most of our facilities there, so people will just die. All they know is that they had malaria and die. Sometimes it can even go to your brain, and they call it cerebral malaria, where you get confused and then you die. So there's a cost in the sense that people die prematurely, um, just carelessly. People who would have been cured if they were diagnosed early enough. And then also it robs society of human labor because people, instead of being active, doing things that are productive for the economy and for their families, are sick and put down. Some women have lost pregnancies and so many other things. So the cost is innumerable. You can't even name it all. And malaria is just one of them. You talk about dengue and so many others like that. I'll just stop there right now. Are you there, Dr. Abiedu?
I'm here. I'm here. Thank you so much. Dr. Mungwa, you've heard what Dr. Lobati said, and I am going to ask you this question. It's going to be probably a major one because it helps for you to summarize some of the things that we've talked about. So you've seen how the former British Southern Cameroons has deteriorated over the years. We have dilapidated infrastructure, including hospitals and schools all over our territory, rundown roads, standing water all over the places, bridges falling apart, creating the ripe environment for some of these deadly but preventable disease to manifest. Those of us who were around in the 60s, the 70s, and the 80s, we can appreciate the difference because we know how things used to be. We were in clean areas. Even though we're a small nation, sanitation was a great thing. We had sanitation officers. How will you, as an engineer, tackle these problems that have led to so many diseases and death in some of our communities? And this question is just to let our people know that we are fighting for an Ambazonia that will bring our future population, future generation, so much hope. So that is one big question I'm throwing out to you. I know you've already addressed some of the answers, but I just want you to put things together.
Okay. This question can be addressed at two levels. Very high level at the governmental level will be what we call the requirement. What are the requirements for a city for it to function properly? It's a very, very complex question, but it can be addressed if you know what you're looking into. But let me answer this second one and then go back to the first and just try to give you an idea. I will not provide an exact solution, but the way you have to think. So we talk about administrative solutions where we have public health policies and education, community health programs, campaigns that educate communities on the importance of hygiene, safe water practices, and disease prevention that can complement engineering efforts. We have educating the population on the risks and prevention methods for water-related diseases, ensures community buy-in and adherence to public health measures. We also talk about regulation and monitoring, where you have enforcement of water quality standards. Governments must implement and enforce water quality standards, ensuring that all water supplies meet safety requirements, because regular monitoring and enforcement of these standards prevent the spread of waterborne diseases and protect public health. We remember that in the 60s, we used to have sanitary officers. I remember very well because they used to be clad in white shirt and trousers and a white hat, almost like what we call the colonial hats. And they go into the marketplace. If you didn't have a store and you were putting your bananas or whatever with flies all over the place, the guy would just put it down and climb on it with his shoes. And that's the end of your merchandise. So people had to be very careful when they are selling bread. It was in a box with a glass where people will look at it, and if they want something, you open. You don't just spread it on a mat and something that people are going to eat. So sanitary officers had great power. They had big influence, and they even visit their homes and see how your latrines are kept. If the measures are not adequate, you may even have a fine. So that was the beginning of regulation, and this is something that we don't see today. At a much higher level, now that we're having our sovereignty, what do we do? And there's something that you call in project management the requirement. The requirement is that if you take the population of a city or town, what will be the design basis for public health infrastructure? What is the design basis? This is a very difficult question, and only very seasoned engineers understand what that means. And that's why engineering in La Republic has failed, because all they do is they come with diplomas and they do absolutely nothing. Foreigners come and they make decisions, and we don't know whether those decisions are applicable or not. And when they talk to people, they say, "Oh, we have big engineers for Polytechnic." I was the head of department. Those kids, I'm not trying to disparage their education. They had top-notch education, but they need a lot of help when they join the go-to society. And that's why in America, even when you have your engineering degree, you have to become an EIT or engineering in training for 4 years, and then another 4 years you have to be under the supervision of a professional engineer. And each of these stages you have to write an 8-hour exam. 8 hours. And means that before you become a professional engineer in America, you must have written a 16-hour exam for the principles and practice of engineering. Okay? PPE, principles and practice of engineering. That's when you have a stamp that you can go around putting on drawing, which means that you understand the regulation, you understand how to deal with communities and so on. We don't have them, and therefore the design basis is to make foundational assumptions and conditions and parameters that project design is built upon, and it is the starting point that defines the scope, key project objectives, environmental conditions, regulatory requirements, and other major constraints. This is the task that I have to do. And if you don't define the scope, you'll be killed in construction. When contractors come and discover that it's a loophole in your scope, they will cost you through the roof. And therefore, if the engineers don't master the scope, when I was putting together this $350 million project, I had just 5 engineers on my team. We had to produce a scope. We divided ourselves. One person was in Queens and Staten Island, another was in Brooklyn. I was in Manhattan and Yonkers. I had to cover all those areas. And finally, we brought a scope. And that scope was solid. And to make sure that the contractors who have been doing this job for generations, because you have families that have been working for this company as contractors or suppliers for the past 50 years. When they see the loophole, they will kill you. This is the knowledge that our local engineers lack. So we have a lot of projects in La Republic. Why do they fail? Because the engineers don't understand the scope. And that comes under requirement. So if I see a design, I'll ask, what is the design basis? Why are you even designing this thing? If you cannot explain to me, then you are totally clueless. It's not going to solve the problem that you intend to solve. And from the design basis, go to the design criterion. The design criterion is a specific detailed technical requirement and guidelines that must be met in the design process. They include the precise standards, measurements, and performance characteristics that ensure design meets its intended function. You must understand the design basis and the design criterion. If you cannot put the two together, and we need that in order to address all these infrastructural deficiencies that we have in our environment. I hope I've answered that. Just to give you a little understand, just one thing here, very important.
Yes.
Can you imagine New York City, where 3 million people come in every day and go home? Have you ever heard of whether the transportation doesn't work, the sewage water system does not work? It always works. They understand the design requirement, okay? And that also applies to Los Angeles, okay?
Wow, I'm looking forward to our Ambazonia that we will be having in the near future. But I have a caller on the line. So I have a caller on the line with a question. I'm going to put the caller on the line. Mayor Kauri, you are on now. You could ask your question.
Yeah, thank you so much, Dr. Abiedu, and I'm so grateful to both Dr. Lobati and Dr. Mungwa for this priceless education that they are providing on your platform today. I sincerely appreciate them. Listening to them, I just feel like I need to go back to school because I feel like I know just too little. I need to learn some more. But I have a 2 questions. Listen, you can go to either of them. We used to have public sanitation officers in southern Cameroon, whose job was to make sure that everybody, individuals and institutions, live up to certain maintain certain healthcare standards in their daily lives. It is not easy, and the benefits to their existence was just enormous. It is not clear to me at what point the colonial administrators got rid of it, and what could have been the justification for getting rid of something that is that beneficial, that grew, that has very high value to society. And then the second question I have is, some of the solutions to the problems that are being identified by both gentlemen require specialized technology and or equipment, and also some of which require high cost, which is either unavailable or inaccessible. There are a lot of healthcare providers in southern Cameroon's Ambazonia today who will be willing to try some of the solutions that they have identified, but may face these challenges. So, are there any suggestions on how such technology, specialized technology or equipment could be accessed, and how to navigate the difficulty with funding that may be an inhibitor? Thank you so much.
Thank you so much, Dr. Mayor Kari. That's a great question.
If you don't mind, let me take the first one.
Yeah.
Sorry.
Listen to them on the phone, or?
Yes, I will.
Okay, go ahead. He's listening.
Now, let me take the first one about at what point did La République literally abandon or neglect the projects that were doing so well in Ambazonia. I want to give an example of the Bamenda General Hospital. Remember that our forefathers left Enugu in 1954, and then we had the so-called independence in 1961. The Bamenda General Hospital was constructed in 1951 when the British were still controlling us. And what happened was that in 1948, before 1948, the British had a dispensary in Banso, and they sold it to American missionaries. That's what became what they call Banso Baptist Hospital. And they constructed the wards that, if you have ever been to Banso Baptist Hospital, you see the wards and how they are connected with hallways that are covered so that when the rain is falling, you can move from ward to ward without being under the rain. If you look carefully, you also realize that that is the same way the Bamenda General Hospital was constructed. So remember that this is an infrastructure constructed around 1951 by American missionaries that the British assigned to construct a hospital for Bamenda. Now, in the early 1970s, Bamenda was only about 50,000. So you can imagine what the population of Bamenda was in the 1950s. Right now, as we're speaking, the population of Bamenda before the war started was over 800,000. The infrastructures of the Bamenda General Hospital have never changed, truly, significantly, since it was constructed in the 1951. La République has maybe dotted a few buildings here and there, but the structure has not changed. So it's not even been brought up to standards to meet the aspirations and needs of over 800,000 people. So why did La République abandon them? Because they have been miseducated. The French, if you read the 6 policies and agreements they signed with Abiedu, said that they would be responsible for education, all aspects of education from primary right through to the university. And their goal is to keep the population, the people uneducated so that they continue to control them. Even those who went to France, they may have studied the same thing with the French in the same universities, but they got a different degree from French citizens. So they look down on the African. So, and then they make them to do studies rather in like social studies and philosophy and things like that, which does not very much apply to sciences. So literally, La République does not know what to do because they have not been properly educated or allowed to know things by the French. You will notice that there's a difference among those who have been trained in the English-speaking nations of the earth or non-French-speaking nations of the earth as compared to those who have been trained in French-speaking nations. The disparity is too big. If you go into university publications and the different levels of rankings of universities, you realize that French universities are very low down there. Even La République ministers go to France for medical treatment. They go to the American Hospital of Paris for treatment. They don't go to French hospitals. So anyway, so La République cannot do what they don't have. You cannot give to somebody what you don't have. That is why they have not developed the hospital of Bamenda beyond what Gebawa, that was the name of the missionary, did in 1951. And they even tried to duplicate that in La République du Cameroon. So you go to some La République du Cameroon hospitals, they tried to build some wards to look like what was in Bamenda. And that is part of the reason why we have not made any progress. And if you remain with them, you cannot make any progress because you cannot do what is not in your head. What you don't know, you cannot actualize.
Yeah.
That is part of the reason why they have rather destroyed what we have, and they have not added to what we have. It's just an example.
Thank you, Dr. Mungwa.
Let me give it a shot as well. I look at it from two different perspectives, and still dovetail from what Dr. Lobati just said. If you ever studied in a French system and you have a diploma, I happen to have one of them, you're going to realize that on your diploma, not only do they say where you what your name is, they tell you where you were born and your age. That is already a discriminatory database. So when they put your diploma with others, they say, oh, this one is French, this is non-French, this is black, this is this, and so on. They already make up their minds. That is the sort of this latent discrimination that we put in diplomas, and that's why Africans had a lower quality during independence. If you go to America or Britain, never do they put their date of birth or where you come from, because I have those diplomas as well. Look at the American diploma; they put your name and the and what they say, Doctor of Philosophy, Bachelor's degree. They don't say Dr. Lobati, born in Kikakilaki in 1972. They don't say that because that's discriminatory. In fact, if there are even civil rights people in those countries, they should say you never put that in people's diploma. So that's the first thing. And people just take this. You realize that they even did that to our A levels. They put your date of birth and probably where you were born. That should not be the case. When you have academic achievement, it should be something that it is sort of neutral. This person has been able to achieve this. It has something to do when you were born or where you were born. That's the first thing. The second thing is that people just fail to understand the whole concept of a Vichy government. What the French went through during the German occupation is still tormenting them up to today. That document that they signed with La République is the same document that France signed with Germany. They simply turned around and gave it to us because of the torment and how Germany was able to exploit the French people during that short period. As I mentioned elsewhere, they were able to take 600,000 Frenchmen to work as slaves in Germany. We don't know that. And they changed the motto from Liberté, Fraternité, or whatever it is, to Paix, Travail, Famille. Peace, work, family. What is the motto of La République? Peace, work, fatherland. Go to somewhere Senegal, it will be Paix, Travail, Justice, or something like that. They keep taking out things and adding them in. Is because of the torture that France got from the Germans in the Second World War. And they are just giving it back to us because now they believe that they conquered us and we have to be subservient. So why would they have any interest in developing anything in Anglophone Cameroon? They have no interest whatsoever. And it boils down to the whole concept of requirement. As I mentioned, when a hospital was serving maybe 25,000 people and now the population has risen to 800,000, there is a problem with requirement. So they don't even have the mental capacity to figure out that as population growth, we need real statistics. Do you have real statistics in La République? No. You have no statistics is relevant. They all lie. They put on paper that the unemployment rate is 2%. You say, what? The place should be flowing with good roads and whatever, but nothing. They're all lying. When they ask them to take an advert in Forbes magazine, let me tell you something that happens. Normally, when you go to an advanced country, they will bring business people to come and project what they can provide. Whether the CEO of, I don't know, maybe a Consolidated Edison that's in electricity and so on, CEO of this company or Treco that manufactures industrial windows. In La République, what do? They project ministers. These are villagers who don't even have a latrine in their homes. They probably defecate in bushes. They call them as the bosses of industry simply because they are head of a ministerial department. So one time when they did that, they discovered it and they kicked them out. They said, we cannot advertise this. Are these people the head of industry? And these are the people who want to come and negotiate with American businessmen. These guys who have absolutely no education whatsoever, just because they've been appointed ministers. That is the BR regime with you. And that is consistent with the Vichy government. The French want things like that. And they say, because these people are so uneducated, whenever we open our mouth, they go on their knees. You can see how the prime minister bows in front of Biya. The guy can make a perfect right angle. It's the same concept. And it works very well. We have to move away from that. I hope I've answered part of the question. Not to you.
Yeah, thank you so much. I think the first part of the question, I got the answer to the fact that it's because if you go with what the accord, the agreement accord or whatever, the cooperation agreement came up with, that France has to control everything about La République de Cameroon and so forth. It includes Ambazonia. They got rid of things that were beneficial to us, like the sanitation workers. They don't care about us. But the second part of the question, I think he still needs an answer because I didn't get that. In terms of specialized equipment and all the like.
Okay.
How will you tackle that?
Okay. Remember that I talked about appropriate technology. And when we talk about appropriate technology, it simply means that technology that is appropriate to our environment. And if you listen to my discourse, I talked about refrigerators. I don't think refrigerators are that expensive. We have refrigerators today. We talk about solar panels because these solar panels now are so cheap and easy to carry. It's not even something you can fold it and put in your handbag. Now, I talk about batteries that can actually store the energy. These are all appropriate technologies. And that's why we said engineering and appropriate technologies. We are looking for equipment that is not that expensive by our standards, something that we can use for small populations. We are not talking about transformers. People don't even know how big a transformer is. It weighs, is as heavy as a Boeing 737. It's very heavy. Okay, so people don't, because I was in charge of the transformer replacement program, so I know how tough this equipment is, and it needs about 50 specialized engineers to install one. So when you see a transformer fail, you see a village come there. Everybody has a role to play. Okay, so we are not looking into things like that. We are looking at appropriate technologies. Okay, ventilated improved pits. We are looking at things that we can handle at our level, and I think I hope I wish that message went through, but that's what I intended it to be.
All right. Okay. Are you okay, Dr. Jakari?
I think
yes, very, very satisfied, and I once again, sincerely appreciate this gentleman for wanting to come on your show today, and thank you for creating the platform for them to come and share. Thank you.
Thank you so much. Bye for now. Okay, bye. All right. Well, we're going to be concluding very shortly. So let me just make this final statement, then I have you guys give your closing remarks. The second part of the program had to do with an appeal letter that the Department of Women's Service wrote to Philomena Yang. I'm going to postpone that for another Horizon program since we're running out of time. So I'm going to just make this comment and then have you guys give your closing remarks. So it is quite important to appreciate how different professions complement others. For example, we see how architects work with interior designers to create plans that are transformed into exquisite buildings. We've heard today how engineering complements medicine in preventing health diseases. Dr. Mungwa, as we conclude today's educational program, can you shed light? You've already talked about this, but just give us the closing remark on how complementing engineering as a 1-2 punch, if you will, in fending some of these tropical diseases in your closing remarks. It's just like it can be a general question, but it's just something that you want to bring things together. And then Dr. Lobati, I'm going to have you make your own comment too.
Yes. As I concluded on the paper, I said the integration of engineering solutions and appropriate technologies in tropical public health care is essential for addressing the unique challenges faced by Ambazonia. By combining innovative infrastructure development, water and sanitation systems, and the application of renewable energy and mobile health technologies, Ambazonia can significantly reduce the prevalence of tropical diseases. Moreover, eradicating water-related diseases and controlling insect vectors through both engineering and administrative solutions will lead to improved public health outcomes and sustainable development. These efforts will not only enhance the quality of life for the people of Ambazonia, but also serve as a model for other tropical regions facing similar challenges. I think that's the conclusion that I, I drew.
Thank you so much. Thank you so much.
Yeah,
Dr. Lobati?
Well, thank you very much. It's really a privilege to be on the same program with you and Dr. Mungwa. I hope that in the future we'll have more of such outings and in diverse platforms to educate our people, because our people really need this information. I would end by adding a little bit to what the caller had asked. How are we going to finance this? Where do we have the money? If you look at many countries around the world, all the Asian nations, whether it's the Koreas or the Chinas, and you can name them, and today India, the development has been done by the diaspora. People who were born in those countries left and went abroad. They know where they came from. They have relatives there. They know the graves of their ancestors. And they generate funds abroad and take it back and develop the country. It is not somebody out there who comes and develops your country, not somebody out there who comes and it truly has an interest in your place. Anybody coming is only interested in generating a profit. That's why you see American companies come and take over electricity like Sonel, and all they want is to generate profit for their investors, even though our people do not get the energy consistently or the prices keep going up. So what I'm trying to say is that the money is there. The diaspora that is motivated will bring the development. Besides the natural resources that we have in Ambazonia, La République and the French are holding us because they want to exploit our resources. And they want to keep us down so they can exploit. Right now we're seeing the oil, but there are many other resources. There are some that are not seen, like we talk about the solar energy, there's wind energy. We'll have our Menchum Falls that we've always talked about that can generate enough electricity for all of West Africa, we used to say. So you can imagine if the potential of Menchum Fall is developed, we will not be without electricity in Ambazonia, and let alone harness solar and wind and so many others. But what I'm trying to say is that the resources will be there. What we need is the freedom to be in our land and do the things that we want to do to develop ourselves, and not to be held captive and hostage by a colonial regime like La République du Cameroon or by the French. That's how I will end here. I'm very grateful for this outing, and I hope that we'll have more opportunities to talk on diverse topics to educate our people. They're hungry for this. Thank you.
Absolutely. Oh my goodness.
Dr. Abiedu,
Yes.
one more thing. Since people are watching this program, there's going to be a continuation of this discussion on ethics, and the title will be America's Resolve to Combat Corruption Internally and Externally, the Lessons for Ambazonia, the Glencoe bribery case. I strongly suggest that you watch it, because it's a continuation of this program, and it's also very educational, and I will be the one of the people talking about this subject. It's really very important for our future, and I'm so happy that you invited me to this beautiful program, and I thank Dr. Lobati for coming at short notice to assist me. You can imagine the amount of the wealth of knowledge that we share with Ambazonians and others, and you see that this is a central issue that affects our future. Thank you so much.
Thank you so much, gentlemen. By the way, Dr. Mungwa, you've been on the horizon before, long time ago, in I think 2019. You were there on one of my shows when we just started the horizon. You may have forgotten, but this is your second time on the horizon.
Okay.
Yes. Let's say that I am just so grateful to the both of you. Ladies and gentlemen, fellow Ambazonians, fellow viewers, you've just, I'm making my closing remarks right now since we're ending the program. You've listened to two fantastic, knowledgeable experts. And I want to thank you for being here today on the horizon. Both Dr. Mungwa and Dr. Lobati has given you a lot of information. So basically, we are looking forward to a future where Southern Cameroon's Ambazonia will be able to thrive under better circumstances, because we have a lot of experts that will help make that land beautiful. They will help make the land livable, where you have, we grew up with this popular phrase, prevention is better than cure. These engineering solutions that we just learned about today, those are all preventive measures that will just be put in place, and you will not even have to think about them, because they're just going to be the norms. We live in United States of America. Some of us, we see how things are just naturally what they are. You don't have standing water anywhere, or in very few areas. So that's why we don't have the problem of mosquitoes rampant. So these are simple solutions that we are praying that as soon as we get our liberation, as soon as we have total control of our land, we have experts like Dr. Mungwa, like Dr. Lobati, thousands of them in different parts of the world that will come to Southern Cameroon's Ambazonia and develop the land for future generations. I want to thank you for watching The Horizon today, and we look forward to another great show with you in the near future. Have a great weekend, and God bless you all. Thank you so much.
Stand with Ambazonia. Empower ABC Amba TV. We are calling on Ambazonians around the world to unite and uplift ABC Amba TV, Ambazonian Broadcasting Corporation. In this critical time of war, ensuring the station's survival is more important than ever. But what does ABC Amba TV truly represent for Ambazonia?
At the heart of Ambazonia's war of independence, ABC Amba TV stands as a beacon. Years of recolonization, annexation, and French Cameroon's oppressive occupation of the southern Cameroon's Ambazonia have led to our exclusion. Our identity was hidden, our history distorted, our sovereignty denied. Queen of England is aware that the British Southern Cameroons were never a colony under France.
Since its inception in 2018, ABC Amba TV has been our lifeline.
Months of diplomacy have failed to resolve the crisis as fear grows over an imminent Russian invasion of Ukraine.
Our work in the dark is our chance to tell our stories to the world, to give voice to the voiceless, and broadcast the truth of our struggle.
We are serious about executing this revolution.
It has become a vital arm of our government in wartime, making diplomacy achievable and showcasing our untold stories.
ABC Amba, you guys know how important ABC is for this, our quest for international recognition.
Your donations can make a world of difference. Every bit of support helps keep our stories alive, our presence known, and our fight in the global conversation.
The moment they notice that we are no longer on air, they think that, oh, maybe La Republic has succeeded. This is about Ambazonia. One thing we must always remember.
Where would we be without ABC Amba TV? Let's ensure we never have to find out.
A revolution is a temporary state of insanity to bring about sanity.
Mobilize, donate, stand with Ambazonia, donate to ABC Amba TV.
Together, let's write the next chapter of our history.
It is better to light the candle than to curse the dark.
Support ABC Amba TV campaign. Ambazonia Independence, voice for the voiceless. Mobilize for change.
There is a civil war ongoing in Cameroon. That civil war is between the southern Cameroon's people and the government of the Republic of Cameroon. These were two countries that the United Nations, by their resolutions, tried to bring together to form a new country, the Federal Republic of the Cameroons, that La République du Cameroon decided to dissolve unilaterally, unconstitutionally, and rather preferred to annex the people of the southern Cameroons. And today, there is no longer any federal republic that was contemplated when the United Nations forced these two countries to come together. So, this is a failed decolonization that has resulted to the annexation of the people of the southern Cameroons. The UN has never looked into this matter like they have for other conflicts in Asia and Ukraine. No. For the 7 years that this conflict has lasted, 1.5 million people displaced, hundreds of thousands of refugees, more than 500 villages and settlements destroyed, burned to ashes, and more than 50,000 lives have been wasted. These are human beings. We are calling on the good people of Brazil and on the good people of the African diaspora to do everything possible to engineer a peaceful resolution to this bloody conflict. They can do that by engineering a proper mediation of this conflict or refer the matter to the International Court of Justice for arbitration so the two parties can present themselves for a peaceful resolution of this conflict. Thank you very much. I'm the president of the Southern Cameroons. My name is Samuel Ikomesako. Thank you.